cancer reached of 40 years after treatment for Hodgkin lymphoma. Student Adriana Domínguez Peñafiel. Definition: lymphomas are cancers that start in red blood cell called lymphocytes. There are two main types of lymphoma: Hodgkin lymphoma, non-Hodgkin lymphoma. Hodgkin lymphoma usually starts in B lymphocytes. B cell glycoprotein called antibodies to help protect the body from hurt.
The lymphatic system is part of the body's immune system, which is responsible for keeping the body free of disease. The lymph nodes throughout the body are connected by a network of lymph vessels. Lymph is a fluid found within the lymphatic system that contains lymphocytes, infection-fighting white blood cells. In the nodes, bacteria and other dangerous substances are filtered from lymph before fluids are returned to the bloodstream. Two types of lymphocytes are B cells and T cells. B cells help the immune system by producing antibodies to eliminate infection. T cells are important in regulating the immune system and in fighting infections. Non-Hodgkin's lymphoma is a cancer that develops in the lymphocytes. The primary types of non-Hodgkin's lymphoma are classified according to the lymphocyte that is affected: B-cell lymphoma, which is most common, and T-cell lymphoma. Cancer of the lymphocytes interferes with the normal immune process, leaving the body unable to fight infections and allowing bacteria, viruses, and other disease-causing agents to overwhelm the body. Simple, infectious agents encountered on an everyday basis that normally would not even be noticed are now debilitating and, in some cases, life-threatening. Because the lymphocytes circulate throughout the lymph system, the cancer can spread to other parts of the body, resulting in other organ function failure. Symptoms of non-Hodgkin's lymphoma include swollen lymph nodes, fever, night sweats, chills, fatigue, unexplained weight loss, and facial swelling. Non-Hodgkin's lymphomas are described as either being indolent, slow-growing with few symptoms, or as aggressive, growing and spreading quickly with severe symptoms. Treatment depends on the stage and type of lymphoma. Standard therapy includes radiation and chemotherapy. Experimental therapies include hormonal therapy and high-dose chemotherapy with stem cell transplant. Most patients with non-Hodgkin's lymphoma can benefit from some type of treatment. Complete cure is possible for many patients. For others, treatment can provide relief of symptoms and extend life expectancy.
Application in nursing. Of the basic of industrial conduct, the latter effect, the treatment of Hodgkin lymphoma has changed with trend toward using smaller radiation, target volumes, lower radiation dose, and more ineffective, generally less toxic chemotherapy treatments.
Lymphoma is a term used to describe lymphoid neoplasms that arise as discrete tissue masses as opposed to widespread involvement of the bone marrow as in leukemias. Within the large group of lymphomas, Hodgkin's lymphoma is distinguished from all other forms due to distinctive pathologic features. This cancer is one of the most common cancers of adolescents and young adults, but also has a bimodal age distribution as disease incidence again increases with age, while non-Hodgkin's lymphomas (NHL) frequently occurs at extranodal sites and spread in an unpredictable pattern. Hodgkin's lymphoma is typically localized to single lymph node or a chain of nodes and spreads first to contiguous lymphoid tissues. Hodgkin's lymphoma also has distinctive morphologic features, particularly characterized by the presence of neoplastic chain cells called Reed-Steinberg cells. Reed-Steinberg cells release factors that induce the accumulation of reactive lymphocytes, macrophages, and granulocytes. These cells have a characteristic appearance with two nuclear lobes, large inclusions like nucleoli, and abundant cytoplasm. These cells have an owl's eye appearance and have a characteristic immunophenotypic include CD15 and CD30, while negative for other B-cell markers. In the majority of Hodgkin's lymphomas, the neoplastic Reed-Steinberg cells are derived from germinal center B cells. Hodgkin's lymphoma commonly presents as painless lymphadenopathy, often in the mediastinum. Patients with disseminated disease are more likely to have constitutional B symptoms such as fever, night sweats, and weight loss.
Pros and cons. Pros and cons, given the high rates of control in Hodgkin lymphoma. Many patients will live long even development on secondary cancer associated in chemotherapy of radiation treatment. Over the years, the treatment paradigm had changed to minimize the risk later toxicity.
Hodgkin lymphoma accounts for about 8,000 new cases per year in the US. Hodgkin lymphoma is typically diagnosed by a biopsy and most commonly from a lymph node that is involved with the disease. Treatment options for Hodgkin lymphoma depend on the stage of the disease and also based on what we call prognostic factors. So again, we broadly classify Hodgkin lymphoma into an early stage, which is usually involves stage 1 and 2, or advanced stage, which involves usually stage 3 and 4. So depending on the stage, we design treatment options. There are several standard regimens that are used in practice. The most widely used regimen is called ABVD, but there are other options also that are currently being used and would be also good options. Although Hodgkin lymphoma is a highly curable disease, we haven't finished our work yet. There is still opportunity to cure those who are not currently cured with the currently available treatment modalities, but also we need to improve the safety of currently available curative regimens through clinical trials. Any patient or caregiver who go on the internet and try to find information could be so confusing, and there's so much inaccurate information on the web. So Lymphoma Research Foundation provide a very reliable source. It is very important to learn about your disease, because then you would know what questions you need to ask when you see your physician, usually within limited times, and also what would certainly decrease anxieties that are usually associated with such a diagnosis.
Conclusion. Second cancer risk after Hodgkin lymphoma has decreased over time, with the observed different larger contact for be decreased in hematologic malignant of the threatened channel in the decades.
Patients with newly diagnosed advanced Hodgkin's lymphoma are often treated with one of two chemotherapy regimens, ABVD or BIACOP. These regimens have been associated with similar overall survival. However, several recent studies have suggested that BIACOP might have 5 to 10% increased survival at 5 years, at a cost of substantial increase in toxicity. ABVD has few long-term toxicities, although pulmonary toxicity from the bleomycin affects about 6% of patients. Biacop, on the other hand, is a more intensive regimen with long-term toxicity that affects nearly every patient, including infertility, fatigue, and future risk of cancer. The current investigators explored the potential for adapting therapy by de-escalating treatment for patients with a good outlook and intensifying it for patients at highest risk for treatment failure. They designed a randomized controlled non-inferiority trial. Patients with newly diagnosed advanced Hodgkin's lymphoma underwent a baseline PET-CT scan, then 2 cycles of ABVD, followed by an interim PET-CT scan. Patients with negative interim scans were randomized to continue ABVD or to omit